Hello, hi everybody. Dr. Charlotte Norton here, Medical Director at the Slimming Clinic. Really excited to be with you this evening to talk about all things weight loss treatment, weight loss injections. I'm here to answer all your questions. So yeah, lovely to be with you, and welcome if you're watching the recording, if you're not joining us live this evening. So as I said, today I've got some questions that kindly some of you've already sent in, but I've also got I'm more than happy to answer anybody's questions, and no question is too silly, whether it's about starting weight loss treatment, whether it's questions about medication, whether you're currently a patient, whether you're thinking about being a patient, whatever question you might have, I am more than happy to answer. So I am Dr. Charlotte Norton. I am the medical director at the Slimming Clinic. So, and I've been working in the field of weight loss for nearly 10 years, helping patients lose the weight that they want to achieve with the support of a doctor-led weight loss program, which has always incorporated medication. And obviously, most recently, we know that everybody's finding out a lot more about weight loss medication. It's become something that lots of us talk about and almost become a bit more acceptable, that people might consider taking medication to help them lose weight, just like people would have considered taking medication to stop smoking. Now, taking medication to lose weight is commonplace, and there's a variety of medications available. So as I said, I can see I've got some people joining me watching. So if you've got any questions about weight loss medication or treatment or what we do at the Slimming Clinic, then please do shout. So I've got some questions that I'm going to answer, and I'll go through in a moment. But just for anybody who might be watching that maybe isn't currently a patient of ours or is thinking about, so obviously we have a doctor-led weight loss service. So that means all of the treatment that we provide patients is overseen by a doctor. So we have an appointment-based service where obviously you attend appointments with our doctors who will support and guide you through your treatment, help you pick the right medication, help you get your best results of those medications. And we have an online option as well, where if you maybe don't want an appointment, or maybe you find time a struggle, that you can go online and you can give our doctors all the information about your chosen medication and your weight loss journey through our online service. So we've got a variety of ways based on you and your lifestyle for you to interact with us. But the key is a doctor always makes sure that you're suitable and safe and on the most appropriate medication for you. And you've always got a doctor to ask if there's any questions, even if you're one of our online patients. If you do have a question or a concern about the medication you have, we have a team of doctors who are always ready and willing to answer those for you, whether you need to have an appointment to chat about that or whether we're able to give you support virtually. We're always here to do so. Right, I'm going to start with some of the questions that we've got. So thank you very much for those who sent them in. The first question I've got is, how do I control my cravings? So cravings are an interesting thing. We get cravings for a variety of reasons. Sometimes cravings are behavioural. We're not, bodies aren't craving it. It's just when we get in from work, we always go to the fridge and we always have a slice of cheese because that's what we've always done. And those types of things are where you need to break a craving like that, is to change a behavior. So maybe when you come in from work, find something else you're going to do straight away, which doesn't draw you into the kitchen, doesn't draw you in to that behavior. So find something else to do. And it could be, especially as the weather's getting a bit brighter, maybe staying outside or going for a short walk or doing something active and changing the actual process and behavior that you do. So that's one way. But I guess if we're talking about cravings, and often we hear a lot about sweet tooth cravings, that can be a real common one. Especially women tend to find sweet tooth cravings can be related to their cycles as well, and hormones. So how do we manage those? So what's the body craving? So sometimes when we've got a sweet tooth craving, we're actually craving some sugar, some energy. Carbohydrates, whether they are sweet or savory, are glucose to the body. They're the same sort of currency. They might taste a bit different on the tongue, but the body breaks them down into glucose, and glucose is what we use in our body for energy. And our brains actually exclusively use glucose for energy. So it's really important. So sometimes when we have a craving, it's because actually we haven't fed our body correctly. Now that doesn't mean if it's a sweet tooth craving, you need to go and find a sweet biscuit to have. It's actually your body needs some carbohydrate, it needs some sugar, it needs some energy. The best way to do that is to give it a form of carbohydrate carbohydrate that's healthy and good for your body. So a whole grain carbohydrate, your whole grain rices, wheat pastas, or if it's a snack, you can get rice crackers or multi-grain crisps and things like that they're actually going to give your body a more of a slow and steady release of carbohydrate, as opposed to something sweet which gives you that real quick hit of sugar, but then actually paradoxically gives you a rise in sugar, but then gives you a massive fall, which then makes you crave more sweet, and you end up in this sort of vicious cycle of going for something sweet. Or fibrous carbohydrates. These are your real friends. These are your fruits and your vegetables, because not only do they have carbohydrate in them, which your body can use, but also they're packed full of vitamins and minerals, which are obviously really good for us. And also they're fiber for the gut, keeps your gut healthy. Healthy gut, healthy body, healthy mind. We know that there's loads of fantastic evidence coming about the importance of gut health, not only for weight loss, but also for overall health and overall well-being. So controlling your cravings. So as I said, if you get a sweet tooth craving, or even just a craving for crisps, for example, think about getting a whole grain variety or a slow release variety. But you can help to avoid these cravings happening at all by putting in more whole grain and slow release carbohydrates into your diet. For example, maybe instead of having something for breakfast, which might be a more of a quick release carbohydrate, like maybe cornflakes, maybe switch it for porridge and oats, which we know release sugar slower. If you have toast for breakfast, maybe think about switching to whole grain toast. So your body's always got that nice slow and steady release of carbohydrate, to avoid you getting those peaks and troughs. Feed it, but we know, and this could be a whole chat in itself, we know that sugar and sweet tooth cravings can be one of the hardest to actually manage to go by. I think someone said they've got no sound, but I'm hoping other people can hear. Somebody did give me a shout if no one can hear. I think I'm working sound wise. But sweet tooth cravings, kicking sugar can be really hard. And sometimes it's not as easy as just quickly changing to whole grain varieties. Your body can crave sugar, and it sometimes takes up to 2 weeks to help, kick sweet tooth cravings. At the Slimming Clinic, obviously, you can work with us, you can work with our dietitian to look at dietary ways to help balance your carbohydrates in your system to help avoid that. But also we have a supplement that we use called chromium. Now, chromium is a mineral, like one of the normal vitamins and minerals you should have, and it works with a molecule in the body called glucose tolerance factor, which is one of these important molecules that helps us manage our blood sugar levels in response to eating, and helps to work with insulin. So it does have some supportive scientific claims that show that it does help with a glucose management in the body. So therefore, it can be a really useful tool when you're trying to kick sweet tooth cravings, and it actually can be quite impactful when you're trying to make that change. So it's a really good supplement to have alongside your weight loss medication, perfectly safe to have alongside any form of weight loss medication. And we find it's a really effective tool for those trying to tackle their cravings, and women that get the sort of hormonal premenstrual sweet tooth cravings, it can also really help then as well. So well worth exploring. It's quite a difficult one to get in your diet alone, so sometimes supplementation is a really good way to help support that. But yeah, that's I could do a whole session about cravings and sugar balance, but hopefully that answers that question. So the next question I've got, which is an interesting one, is does a calorie deficit work? It's a really interesting question. I'd love to find out a bit more from the angle that you're asking this. So when we think about weight loss, we hear that old, eat less, move more, which weight loss is not that simple. We know that. We've been treating patients at the Slimming Clinic for over 40 years. We know that it's not that simple. If it was, it would be really easy, wouldn't it? But if we try and break it down to the science of the body, to burn excess stores, because fat, essentially our fat layer is excess fat storage in the body. That's what we want to get rid of when we say we want to lose weight. We don't want to be losing our muscle mass or our water mass. Water is really important to the body. We want to be losing the fat mass, the excess fat mass that we don't need. So to do that, to get rid of that excess energy, you have to create an energy deficit in the body. Now, obviously, there are sort of 2 ways you can do that. You can either take in less energy, i.e. eat less, or change what you're eating, or you can burn more energy by doing more exercise. Both are great ways to lose weight. Both are really good when you do them together. They give you the most sort of bang for your buck. So a calorie deficit does work in the sense that it will give you an energy deficit in the body. But it's not just simply a maths game. It's about what are you eating? What are those calories? One could say if you you could create a calorie deficit by simply just eating chocolate, but eating 1,500 calories of chocolate a day. That's not going to give you your best weight loss results. You're not feeding your body well, you're not feeding your machine, you're not getting your metabolism fired up and working, which is what we want to happen if we want to burn our fat stores and lose weight. So at the overall level, a calorie deficit, yes, it is your tool. We should always be looking to eat less, but it's also really important about what you're eating. Feeding your body well, giving your body the right foods, all of that will actually make a really big difference to your weight loss trajectory. So yeah, it would be really interesting. Maybe you found previously that you think that maybe a calorie deficit hasn't worked for you, and sometimes it can be actually it was just not put together in the right way. Maybe what you were eating wasn't quite right. Sometimes our bodies can be in lots of different ways. I mean, everybody might, you might recall that for years, and this happens as we maybe start to get a little bit older, you could always lose weight just by ditching those extra snacks, or that always used to work for you. As our bodies change, as we age, as we have different stresses in our lives, sometimes what we've done before doesn't always work again. So it's all about looking what you're eating, when you're eating, to achieve that energy deficit in the body that helps you burn that fat mass and achieve the weight you want to be. So I hope that answers that question. This is another one. Actually, we've touched on glucose. So this question is an interesting one. Again, I would love to have heard more from who's asked this one. So if I'm on a low carbohydrate diet, should I be taking supplements to make up for the loss of glucose I'm getting? Because remember, carbohydrates get broken down to glucose. Glucose is the important energy molecule we have in our body that our brains exclusively use. So should I, if I'm having a low carb diet, should I be taking glucose supplement? No. I'm going to say absolutely not. No, you don't need to supplement with glucose. The only people that need to supplement with glucose are people doing extreme sports where they've depleted their entire glucose stores and they need to run a bit further. No, don't take glucose as a supplement. No, you should be getting it from what you're eating, and you should be adequately able to do so through diet. So low carbohydrates can get a really bad rap, and lots of us think, if I just ditch the carbs I can lose weight, and that can be true to an extent, but carbohydrates are really vitally important to the body. It's about eating the right ones and the right amount of them. Fat is the food source that has the most calories per gram. So that's the one that gives us the most calories taken into our body. Carbohydrate, but fats are really important. Carbohydrates don't have as many calories per gram when we eat them, but sometimes if we're eating lots of white and simple carbohydrates, we can end up feeling bloated. Carbohydrate stores store in places like our muscles, and every time we store a bit of carbohydrate in our bodies, it draws water to it, it attracts water to it, so we end up gaining weight or feeling like we're gaining weight because our body's suck in a little bit of water. So carbohydrates get a bad rap, but I'd say carbohydrates, a low carb diet should still be having some of those whole grain carbohydrates, the pulses, the grains, the beans, the legumes, as well as having your fibrous carbohydrates, your fruits and vegetables, and that should give your body enough glucose to work. If we think back to the days of old, days of old, because people still do it, an Atkins style diet where you have extremely low carbohydrates and any mostly proteins and fats, what you're asking your body to do in those circumstances is your body can make glucose from other things. So you put your body into a state of ketosis, which is where your body uses other molecules to convert them in to glucose, because your brain can only use glucose. So again, that's not a balanced way to lose weight for the long term, nor to manage your diet long term. But to answer the question, no, I wouldn't take a glucose supplement. I would just make sure I was having enough of the whole grain varieties. I mean, if you make sure out of the total amount of calories you eat each day, if 40% of them come from carbohydrates, you're not going to gain any weight. That'll be an effectual way to lose weight, but just make sure they're the right ones. They're your fibrous fruits and vegetables, they're your whole grain varieties, and you shouldn't eat glucose at all. If you find that you're feeling sluggish and you're feeling that you're not concentrating as well and are concerned about that maybe you're not getting enough energy to your brain, think about hydration, because sometimes we're just not drinking enough water, and hydration is really important too. So make sure you're taking water on board. Got a question here is, why is it so expensive? So thank you for the question. I'm assuming you might be asking about weight loss medication being so expensive. And these newer weight loss medications, the injectable weight loss medications that have come to market, are new drugs. New drugs to the market tend to always be a bit more expensive at the beginning as they first come. But secondary is the way the drug is made. The drug is a cold medication, so it's got to be stored carefully, created carefully. It also is an injectable, so it comes with a pen that's pre-filled, that has a mechanism within it. So the drug itself at cost, buying it directly from the suppliers is an expensive drug. So that's why the cost is out there in the market. There is, variations on the price depending on what you get with your medication. Sometimes you may find that you get medication alone with some providers. Sometimes you get medication with the support of a team like ours, which is doctors and dietitians that can support you whilst taking your medication. So yeah, the at the moment the medication is expensive. I mean, Mounjaro, for example, isn't even a year since its launch, so we tend to find that new drugs to market always have a more expensive price tag to them. Right, next question is I've got from here. So I can't take the injections due to a health condition. So that's really interesting, and thank you for asking it. So there are some health conditions where the injections might not be suitable for you, and that there's not that many with the injections actually. Relatively, quite a lot of people can be suitable for them, but absolutely there are health conditions where they might not be the right option for you. At the Slimming Clinic, we've got both injections and weight loss tablets. The tablets we've been prescribing for over 40 years, so quite a long time. And often, if the injections don't work for you, the tablets may. Again, without knowing what your health condition is, can't say for sure here, but well worth exploring if you haven't spoken to a member of our team. Those weight loss tablets work again in the appetite control center of the brain to reduce appetite, reduce hunger. So the injections work in that center of the brain too, so there is an overlap in how they work, and it's all about appetite control and hunger reduction. But yeah, it could be worth exploring if you found that maybe the injections aren't medically suitable for you. Again, it depending on what your health condition is, it's worth having a chat with a clinician, because sometimes there are ways to work around it. Another question I can see here, sorry, just making sure I can see, from Sue is, I've been taking since November, but last 2 times had a really bad tummy. So it depends. So with these medications, with the injections, which I'm guessing is what you're saying, some of their side effects are gastrointestinal. So as I mentioned, they work by the controlling the appetite control center of your brain to reduce hunger perception, make you feel less hungry. But they also have an effect on your gut. They slow down gastric transit. So that means they slow down how quickly food moves through your gut. And that therefore gives it its gut side effects. Some people find they experience very little. Some people experience quite a bit. Some people find they can't tolerate it. So there is a spectrum here. So what we tend to say is, it depends what you've done. So if you're on a dose and you're getting a side effect and it's upset your stomach, obviously if it's intolerable, then stop it. If it's tolerable, then sometimes it's worth continuing on at the same dose. Don't increase your dose. Stay on the same dose. Give your body longer to get used to the medication. And sometimes that can be enough. If you find that the injectable medication you're taking, for example, maybe you're currently taking Wegovy, that's not, even though you've stayed on the same dose, you've tried to persevere, but it's just not working for you, then often switching to the other, Mounjaro, and vice versa, Mounjaro, Wegovy, no one's superior here in that regard, you might suit your body better. So try both. But yeah, it's really important to not rush the dose with these medications. Lots of perception is you've got to get to the highest dose to get your best weight loss results, to completely obliterate your appetite and get where you want to be. That's not the case. And you're only going to get to that top dose if you make sure your body is tolerating your meds. So start at the lower dose and continue on with it, even if it's for a further 4 weeks before you go up, because you'll get a better overall result at the end anyway by finding the medication that works for you, or switch between. Again, if you switch, you do have to go back to the beginning dose of each pen, because they don't overlap in that way. But again, you might get the best results. So I'm just sort of reading here. Started on 2.5 and went up to 5 with no problems. Could the pen be faulty? No, there shouldn't be. Giving you stomach upset from the dose wouldn't be a fault with the pen. Faults with pens mean, for example, the medication isn't coming out or the needle won't fix. So no, the faulty pen, no, there shouldn't be. So it could be that the 5 milligram dose maybe hasn't tolerated you haven't tolerated it as well, or I can't work out if you've gone from 5 to 10. But yes, you stopped it for 2 weeks, then started on the 2.5. So 2.5 milligrams means you're obviously on Mounjaro, so maybe switch to Wegovy might be a good option for you there. Can weight loss medication be given with Ramapil tablets? Great question, Gillian. Yes. Obviously, it depends what you're taking the Ramapil for. Most of the time, we're looking at maybe blood pressure reasons for that drug. I'm just taking a guess, and usually, yeah, that should be absolutely fine, unless you know, again, these weight loss injections and the tablets generally can be well tolerated. So yeah, that wouldn't preclude you from for taking the medication. And you know, these questions are fantastic. If you've got questions or you're concerned about something with your health, this could be a really good reason to have a consultation with a member of one of our doctors. We have an express consultation, which is just a 20-minute consultation with one of our doctors. If you just want to clarify a few things, you know, maybe you've thought about buying the medication, but you're just not sure, you want that extra reassurance of a doctor chatting with you live, answering your questions, then, you know, our express consultation is a really good option. You get a questionnaire beforehand to read, and then to read and fill in, so the doctors get a bit of information before you attend, so that you get the most out of those 20 minutes with them in terms of picking the medication that's right and good for you. But yes, Ramapil shouldn't be an issue at all. And it's really important, whether you purchase medication from us or anywhere, online or in an appointment, just tell the clinician every medication that you're on, every condition that you have, because that way, as clinicians, we can make sure we give you the right dose that suits you the best and gives you your best weight loss results. Someone said talk about the golden dose. I've not heard of golden dose. That's not a thing that I am aware of. There is no golden dose. The clinical trials, the information that we get from the medications is based on the top dose, because that's the way the clinical trials work. So when they give you a level of weight loss, they give that as when people have been on the top dose for a length of time. But the length of time it takes people to get to the top dose varies. And at the end of the day, as a doctor, as a clinician, when we are prescribing a medication, we are prescribing it for benefit. If you are getting the benefit of controlling your appetite and losing weight on a dose, there is no rush to go to the next dose. As long as, you know, it's perfectly safe to take your time and go up in dose as you are ready, as your body is ready, and as you need to. So again, there's no golden dose you've got to get get your best weight loss results. That everybody is very different. We have hundreds of patients taking this medication. Some people stay on the bottom dose the whole time. Some people quickly go to the top dose. Everybody's different. As long as you're losing weight, tolerating the medication, and achieving that weight loss results, that's the golden dose for you, as it were. Someone says, is it safe? Absolutely, these medications are safe. That's the important part, is of just telling us, you know, telling your doctor, telling the clinician all of your medical conditions, because sometimes it might be that, you know, we give you a little bit of advice. Maybe you're somebody that struggles with constipation. So if you start this medication, we'll be able to say, you know, let's keep an eye on your constipation. Let's think about advising you on what you should eat and a bit more water to drink to make sure you don't get a compounded effect by the medication. So they are safe. They wouldn't be prescribed. And this class of drug, the GLP-1 drugs, have actually been around since like 2015, when Saxenda, the first version of this, came to market, and they've been used in the treatment of diabetes a lot longer than they've been used in weight loss. So we have lots of evidence that supports that they are safe to use. And again, taking them correctly, speaking to a prescriber that takes into account your the medical information and prescribes the right dose for you is absolutely the right way to go about it. Is it safe to extract the medication from the pen after 4 doses? I wouldn't recommend it. The reason I wouldn't recommend it is you don't know how much is in there. You don't know what dose that is. I've heard about, we hear about this, and obviously where the pens are made, there's always a little bit of excess medication in there. That's to avoid any mishaps. So when you first use the pen and you put the pen on, you have to prime it a few times to make sure the medication flows through the needles. They put a bit of excess in there, and they put a little bit of excess should you have a bit of a mishap and squirt out some dose that's not correct, so that you've definitely got your 4 doses. So there's always a small amount left. If you go about trying to extract that one, you could find that you actually inject dirt or contamination into the liquid, and therefore you could end up, you know, giving yourself a reaction when you inject it. Might not be clean. And 2, you don't know the volume that you take out. You don't know the amount of dose that's in there. If you ever give yourself too much dose, you could end up getting a nasty side effect because actually you weren't ready to take that amount. So I wouldn't recommend it. I get it. I get the fact that these medications are expensive, and they there's still some liquid in there that you want to use. But my recommendation as a doctor, it wouldn't be to do that, because it's uncontrolled and unknown, which we don't like in medicine. The tablets, yes. So we have several types of tablets available, tablet medication at the Slimming Clinic. They are called centrally acting appetite suppressants. You can find out more information on our website. There's two names. One's called Fentanyl and the other's called diethylpropium. Both are we have both available. They have different strengths as well. So these are tablet medications that again have that ability to reduce your appetite, help you feel less hungry. And up until the launch of these injectable medications, that was what our doctors at the Slimming Clinic have been prescribing for the last 40 years. So, we have a lot of patients that have used those tablets. You have to still take your calorie controlled diet and take the good steps of what you're eating. But yes, they are available. You can find out more information on our website. So can you order online? Yes, we do have the ability for you to order online. So you have two ways to interact with us here at the Slimming Clinic. You can use our online prescription request service, or you can have an appointment. The online prescription request service, you can navigate to our website, read about the medication that you are interested in, and then you can put purchase and put through your request. So once you've purchased, you'll be given a form to fill in that medical information. One of our doctors will then look at that medical information. It is a doctor. It's not, it's a qualified GMC registered doctor specializing in weight. That's the same doctor you would see at an appointment. Looks at that, and then if all is well and safe, and we've got all the information we require, then prescribes the medication, and then it's dispensed and dispatched by our own pharmacy and delivered to you. So yeah, there is that, but there is that ability to obviously know that it's been approved by a doctor. There is an additional charge if you want to speak to a doctor. Absolutely. Our appointment pathways, you pay for the time with the doctor, which everybody's different in terms of what they want. Obviously, by speaking to the doctor, it's the quickest route, because we see you, we talk to you, we get the information there and then, and we can authorize your prescription straight away. So often it can be a bit quicker in terms of getting your medication authorized and on the way to you. And also it gives you a chance to ask those questions, especially if you're a bit nervous or hesitant about starting, or you've got a chance. And we've got the two ways. We've got the longer sort of 50-minute appointment that gives you a longer time with the doctor, but we've also got the shorter sort of 20-minute appointment as well. So to try and fit in with sort of what everybody would like in terms of time and with spending time with the clinician. Sue, you've asked me another question. Can I dose 2.5 from a 5 pen? No. It's uncontrolled. So the way the pens are made is you titrate to the dose and inject. There is stuff out there about using clicks or counting clicks to try and work out how much you could inject to not inject the right amount. But again, it's not a fail safe. It's not been tested and tried. And again, you might end up injecting the wrong amount. However, if you've got a 5 milligram pen, so it depends how you store. These medications have to be stored cold. And if you've kept it stored cold, then it will continue to work until its expiry date. So even if you deviated or went back to a 2.5 pen to take a 2.5 dose, as long as you keep your 5 milligram pen stored cold, you can then, when you come to the 5 milligram, go back to use it. So it's not wasted if you've kept it. You've used a clean needle each time you've used it, and you've kept it stored in a refrigerator. It will be fine till its expiry date. It's only when you let one of these pens warm up to room temperature, and you've left it in room temperature, that it then only has sort of a month to 6 weeks. So Mounjaro is about 6 weeks before it then they don't recommend that you inject, not because it would be unsafe, but just because the medication might have degraded and it might not work as well. So that is an option there. So I've been on 5 milligram Mounjaro, but I haven't lost weight. Any advice? Again, another great question. So there's so many things that we could talk about here. So I'll try and quickly navigate through a few. So number one is the reason you're taking the medication is to help control your appetite and be able to stick to a calorie controlled or a healthy diet. So the first thing to look at when you're not losing weight is, what are you eating? When are you eating it? So again, exploring that. Are you eating a good amount? Is what you're eating healthy? Are you giving your body everything you need? Are you eating enough? Because if we undereat, it does actually slow your metabolism down and doesn't give you as best amounts, finding that sort of sweet spot of feeding your body enough, but getting that calorie deficit. And then there's the drug. Is the drug suiting you? If the drug isn't giving you its effect, then do we need to change dose? Do we need to change form? So there's a few reasons why you might not. So again, these medications, fantastic for weight loss, but the work still kind of comes from you. I mean, wouldn't it be fantastic if there was a drug out there that we simply took and it just melted the fat away? That would be brilliant. And I'd love to be able to help people simply as that. But sadly, you still have to make the dietary changes and make the lifestyle changes. So alone, the medication won't necessarily get you your results. You do need to be still looking at what you're eating. You still need to be trying to move a little bit more and kind of putting that all together with the medication. So again, praise whether you're a patient of ours or not, sometimes just having a quick appointment with the doctor or our dietitian. We have a fantastic dietitian service at the Slimming Clinic. Again, a very non-judgmental. It doesn't matter what you're eating. We just want to help you get your best results. Have a quick appointment with the team. And you can absolutely dig into that in a bit more detail. Sometimes people get to a plateau. There's if you've been losing weight, there's always that weight that you just really struggle to push through, and your body sometimes do that to you. We have what's called a weight set point sometimes that's really hard to push through, and sometimes we've got to have a big change up to get us past that. So again, it could be that you're about there. So again, well worth getting in touch and finding out a little bit more. Fantastic. So thank you. These have been some really, really good questions, and I hope that's helped. I think there's one more question that I would like to cover before we sort of conclude this evening, but please do shout from the ones that sent in before. There was one about, I've seen in the news that there are fake pens on the market. So, and how do I know that I'm buying legitimate stock? This is so important because, again, you might find that because it's expensive, sometimes it's tempting to look for the cheapest option, and sometimes it may be a case that that it's not legitimate what you're getting. So I think there's a couple of things. Look at the service that you're going to. If you come to a service like ours that's got clinicians, you can see that we are CQC registered. So the Care Quality Commission for the UK regulates what we do. You can see our doctors and you can get their GMC number, so you know their number, so you can look them up that they're a credible prescriber. You can see our pharmacy details. Again, the pharmacy details should be available. You should be able to see the pharmacy registration number. You should be able to have a contact number for the pharmacy. If all of that's in place, you should be looking at legitimate service, which should be providing you with legitimate medication. Again, when you get the medication, has it been sent to you cold? Is there, if we're looking at pens, that's what I mean cold, is the liquid clear? Is it tampered or untampered with? Tablets again, is there any sign that the box has been broken or tampered with? So these are things that you can absolutely look to make sure. But a legitimate service will always have a way that you can trace back. You get in the batch number and expiry date with the medication. You're getting it in a box that's written in English. You've got the pharmacy details and the clinician details that's prescribed it for you. So they would be my best. And sometimes there is a slightly additional cost compared to maybe someone who's selling it fake or illegitimate, but at least you know that your money you are spending is being spent getting the genuine medication, which is what's going to give you the results that you want and need. Can a dietitian recommend the medication? Dietitian can absolutely talk to you about the medication and the medication options, but they can't prescribe. Our dietitians are not prescribers, so you would need a doctor to prescribe for you, but they can give you advice on the medications available here at the Slimming Clinic anyway. Another one, which supplements do you advise whilst taking Mounjaro? So I think the one supplement I would say is absolutely vital is a multivitamin, because when we are on a calorie deficit diet, often we can be eating not enough or not the right things and not giving our body all the nutrients it requires. So a multivitamin makes sure that you're getting all those important trace minerals and vitamins that your body needs. to help alongside the fact that you'll be eating less, because your body needs all of those to have its metabolism firing. We need a metabolism firing to help us lose our weight. So that would be number one. The second thing is a really good omega-3 supplement. You might hear them about fish oils or omega supplements, because we know when we've gained weight, fat tissue doesn't sit there quietly. It actually causes issue, and it can create a level of chronic inflammation or low-grade inflammation in the body, which we know by taking an omega-3 supplement can help to reduce that level of inflammation again and help with our weight loss efforts. So they'd be the two ones I'd say with a weight loss program I would absolutely recommend. Are the tablets as effective as the injections? So when it's again a really good question, and I think it depends on how we look at it. The most effective drug for you is the one that gives you your best results, and that might be tablets or it might be injections. Everybody is really different. If we look at clinical studies, you get levels of data, and the clinical studies for the medication were done a long time ago. They've been actually available since like the 1950s, the tablet medication. So the clinical trials are a while ago, and they're not in direct comparison to the injections. But we look at our patients at the Slimming Clinic all the time. We have to. We're a CQC regulated provider. We can't give you medication if we don't show that it works for our patients. And we see that patients do really well with both. And it's all about the right medication for you. So it's hard to say. I can't give you a quantitative number that you will achieve if you take tablets versus injections. However, what I can say is that we will help you find the right weight loss tool for you to help you get your best weight loss results. So I think there's a couple of things that are that I come out of today. There've been some great questions, all of which I would encourage you to speak to one of our doctors if you want to. But we do have the online service, and please go on and have a look there on our weight loss programs, our tablet and injection weight loss programs. We have some offers that are available on our website at the moment. So if you are thinking about going ahead with a weight loss program, obviously all of our weight loss programs involve us shipping some medication to you, and we have a free P&P offer at the moment, which again can absolutely help with getting your medication to you. So hopefully thank you for all the questions that I've had. It's been fantastic. Really, I prefer to sit here and answer your questions all evening. Talk about electrolytes, praise. By electrolytes, I assume you are meaning electrolyte support in terms of drinking electrolyte based fluids. Electrolytes are essentially, again, the sort of trace vitamins and minerals that your body needs. So electrolytes, we tend to think of them in sort of drinks and supplement based type drinks, where you get your vitamins again from them. So again, a credible and well-balanced electrolyte supplement. It can be a great way to get your vitamins and minerals if you don't want to take things like a multivitamin tablet. You don't need sport type drinks. You don't need glucose filled electrolyte drinks. The way that electrolyte drinks and electrolyte supplements are generally made is they're formulated in a way that helps to push the nutrients into the cell well. It matches the cellular environment of the cells, which means that the nutrients go into the cells better. We want the nutrients in our cells to feel our best. So again, as long as you're getting a good one that's well balanced, electrolytes can be a great way to get hydration, because you generally drink with them, and get those vitamins or minerals, generally more than vitamins, into the body in a good way. But again, I'd avoid something that's heavily full of glucose, like a sport-based drink, because again, you don't need the extra glucose if you're dieting. Can I use sea salt as an electrolyte? If you mean in terms of seasoning your food, then again, always be careful with salt in seasoning. You don't want to be giving yourself too much. I mean, if you mean diluting it in water, then yes. I mean, sodium, which is what you get from salt, sodium chloride, again, are two important electrolytes alongside other things. So technically yes, but you just need to make sure that you're not overdosing on the amount of salt you're taking. And also, I don't think it'd be particularly pleasant to drink in that way. But the premise is absolutely, is absolutely right. Salt, when it's broken down, is sodium and chloride, which is obviously two important cellular electrolytes for the body. Well, thank you, everybody. It's been really great. So it's been a lovely, nice spending evening with you. I hope everyone's found it really valuable, whether you've joined us live or you are listening in the future. And again, I do these regularly. So if there isn't a question I haven't answered, or you didn't want to answer it live, then send it through to us. We will answer it. And yeah, thank you very much for joining me this evening. And yeah, I hope everyone has a good rest of their evening. And please, I see there someone's asked for a link to the website. Absolutely, we'll make sure we put that in the comments so that you can see a link to our website, so you can have a look around at what we offer and what we do. And yeah, thank you very much, everybody, for joining this evening. Have a lovely evening.